and we are going to really share, and I want to welcome all the people who have joined us today in this live, and we are going to share very important aspects of life, and you should not miss anything. So just be close to us, and we are going to share. So just invite a friend as we set our microphones ready for the interaction. Yes, I can see we have more people joining us, and we are super excited. Don't forget to hit a like on our live, and a like on our video. So I want to really welcome you once again to this live today, and today is just 10th of the month of March. This is 2026, and in this live specifically we are going to share about the things that are ongoing. Today is 10th. We began our glaucoma awareness week. It began on 8th, that's March, and up to today, and we are going to move up to 14th of this very month. So I really want to welcome you all, and tell you that you can invite a friend to be part of this live. And if you are not able to invite a friend to be part of this live, you can still share our live after our broadcasting, so that we can be able to inform more people about the challenges that are bringing or they are coming towards our sight, towards our eyes, so that we can prevent the blindness. Remember last time in our last live, we shared about each one's role in the fight of avoidable blindness. But in this live today, we are talking about glaucoma, and glaucoma literally, it doesn't mean that it is that, but for a lay person to understand very well, glaucoma is eye pressure, and for it can cause permanent and irreversible blindness when it is not diagnosed early. So it means that if someone is not being attended to early, we can have a person losing sight completely, so that it does not come in. And really, it is very important to all of us to see that we can prevent the blindness as early as possible. And I'm really grateful for all of you who are joining us on this live. And please, you can really share in where you're watching from. And if you have a question as we keep interacting, yes, please don't forget. And if you're watching us for the first time, really don't forget to subscribe to our YouTube channel, so that we can be able to share more information about eye care. And if you hit a subscription button and you put a notification bell, just know that every time we do anything or we share any information, we shall always be able to, you'll be able to access our information as we go on. So as we have said, our live is on, and specifically we are talking about glaucoma, and in the layperson's language it is called eye pressure. Glaucoma is a cause of permanent blindness or irreversible blindness, and if we don't really come up early, we can have very many people lose sight. And even if you have whatever amount of resources, you may not be able to recover sight. So it is very important to all of us who are watching this live to have an eye checkup. And as we are going to share, we know we have been talking about, we know something to do with pressure in the body, but we also have pressure in the eyes. The pressure in the body, specifically, it's a response of blood volume and or resistance in the blood vessels, in the flow of blood in the body system. But specifically, in eye care, we are looking at a fluid in the front part of the eye, that's in the anterior segment, and this fluid can cause or can accumulate and cause pressure in the eye. That's why in this live, we are talking about glaucoma. It is an awareness week, and this eye pressure can cause your eyes to stop seeing for the rest of your life without any recovery. Even if you travel to whatever country, you may not be able to get the sight back, if at all we identify you at a late stage. So what I'm saying is that eye pressure, a person's eye has a given amount of pressure that it can hold. A normal eye is supposed to hold a pressure range between 10 to 21. But if your pressure goes beyond 10, then beyond 21, then it causes what we call ocular hypertension. Ocular hypertension is almost related to body hypertension or blood, high pressure in the body and so on. But for it is because of the accumulation of blood and resistance in the flow in the body blood vessels. But the eye pressure is because of the accumulation of the aqueous humor and sometimes the resistance in the flow of the aqueous humor out of the anterior segment. So it is very, very important for us to really have an eye checkup. And if you're watching this live and you are able or you have ever been tested and checked the pressure, please, you can comment in the pressure they told you your eye carries. If you have never been checked the amount of the pressure in your eye, please make it a point. If you're near our catchment area, that is Eastern Uganda, please, you can visit us. If you're in a different country, you can look out for any eye facility and you go and check the pressure in your eyes. Because if you don't check, please, just know that you are at a risk of losing sight completely. Please do it before the time is late. So what I was talking about is that the pressure in the eye is because of the accumulation of the aqueous humor in the front part of the eye, and this pressure can be transmitted up to the back, to the retina, the back of the eye. So if there is a continuous rise in the eye pressure, then it can cause damage to the optic nerve. You know, inside the eye, if you can look in my camera, there is a nerve that takes information to the brain. So behind it, it is lined by a very weak membrane called a lamina cribrosa. This weak membrane is subject to being stressed by high eye pressure. So if there is accumulation of the aqueous humor, this pressure will come backward and will squeeze this part of the eye where we call the optic nerve. Now this optic nerve will be damaged because for it is not strong like other sides of the eye. These other sides of the eye is given a very strong, thick wall that can resist the pressure increment in the eye. But at the back here, it is lined by a very weak membrane, and because of that continuous operation of the pressure, the optic nerve, it can cause this nerve to stop or to enlarge in size. I can use that for all of us to really understand that can really enlarge in size. It can cause the optic nerve to strain and strangled, and it stops taking the information to the brain. What do I mean? Is that if your eye is having high eye pressure, many times the optic nerve is being oppressed, so it cannot be able to send the information straight to the brain because this pressure will be able to damage here. So now in this case, it is not a quick onset. It's not in a few minutes that it happens, but when the pressure in the eye builds up, it stays for a long period of time. It keeps on affecting this optic nerve for a long period of time. It keeps straining it, and when it keeps straining it many times, this optic nerve now loses its function. And many times people come to us when this optic nerve is almost gone, because here in most of the people, mostly in our local setting, in our village settings and African setting, many times people, we do respond to pain, and in terms of eyes, we do respond on stopping to see. If someone stops to see, we'll be able to come to the hospital. If someone the eye is paining seriously, surely when it's paining seriously, then when they come to the hospital. But now when the pressure is being built up in this eye, it keeps affecting the eye, it keeps affecting the eye, it keeps affecting the eye until the optic nerve is now completely done. That's when most of the patients come visit us. Because what we want you to know, you and me to know, is that eye pressure does not pain, more so on the type of pressure I'm talking about, what we call open angle glaucoma. For it doesn't pain, it is a silent thief of sight, and many times in our videos we have been talking about it. For it doesn't pain, someone stays very well, stays and is living in a good life, no pain, no everything. So, but when the optic nerve is being strained, so the time it stops seeing, that's when most of the times people wake up and say, you know what, I can go to the hospital and maybe probably recover sight. And what I want to tell you here on this live is that if you live until your optic nerve here is damaged, if your optic nerve gets completely damaged, then we may not be able to recover sight in that eye. Sometimes we cry of money. I don't have money to go to the facility. I don't have money. But when someone becomes blind, we have very many people who come on board, very many people who donate, very many people bring in resources on board to see that someone can be able to go to the hospital. But I want to tell you that however much resources you collect, if the optic nerve is really completely damaged because of the eye pressure, then we cannot recover sight in such a globe. The person who have the eye will be able to move, and everyone is very satisfied that this person sees well. But when it does not actually see, you know, blindness in our field, blindness is a very funny thing. A person can see a very normal structure, can move this side and this side, but yet the person himself is not able to see. So checking your eyes as early as possible, as today, is very, very important, not only for you, but for even your family. What I can talk about again about glaucoma is that the most condition that we have seen is that most that we have seen is that it moves in blood. It's genetical in nature. We realize that if one patient has come, many times we always give time to check even the caretakers who have brought them. You find out that when you diagnose in a son the glaucoma, you are able to check also the father who has escorted the child to the hospital. And in most cases, when we find out from the parent or the relative who has brought the patient, many times we find them, the caretakers are also at a certain stage of the development of the disease. So it is very, very important to all of us. Some of us, we always talk and say, there is a relative of mine who lost sight. There's a relative, we have all those stories. Many people talk about it when they get to the hospital. They think back, and sometimes they put the shield and said, you know what, I think my grandfather lost sight because of age, lost sight because of this and that and that. Yet the reason why they lost sight was because of glaucoma. But because we cannot be able to carry on information, it is easy to inherit other things, but to carry on the information from one generation to another, there is always a knowledge gap. So even if a parent has lost sight because of glaucoma, many times the children, some families, they have their parents with glaucoma, but the families don't know that their parents have what we call eye pressure. And even sometimes when they know, they give it an ignore because they don't know how dangerous it is to have such disease. So I think it is very important to all of you who are watching on this live that it is very important for you to have an eye checkup in this period of 1 week of awareness. And if you have a relative who has ever had what we are talking about as glaucoma, or what we are talking about as any eye problem, you may not be able to know the name exactly, but if you have any relative that has ever had an eye problem, it is very, very important for you to schedule an eye checkup with a very qualified, competent eye health worker who can be able to guide you. Yes, if you're in our region, our area of operation, please you can come up and reach out to us so that we can be able to check. If you're not nearer to our catchment area, please you can still travel and or you get to any facility that is near you that has a very well stabilized eye clinic or eye center or eye department, and you have your eyes checked. Let us not go to wrong directions. Let us go directly to an eye health worker who will be able to find out at what level is your optic nerve damaged. Yes, and if he knows, sometimes they will be able to recommend other tests. We have very many other tests that we can do to really confirm this disease that we're talking about as glaucoma. One of it, I've already talked about measuring your eye pressure. And once your eye pressure is beyond 21, yes, already you are at a level of being diagnosed as a person with eye pressure. Then also sometimes there's some type also of eye pressure whereby the pressure can be between 10 to 21. But when we look at optic nerve through an eye examination, when we look at the optic nerve, we find out that your optic nerve is completely damaged. So it is very, very important in an eye checkup. Why am I recommending to get a very qualified eye personnel to check your eyes? Is that a qualified eye personnel will be able to see up to the optic nerve. So if he's able to see at the optic nerve, he can be able to grade the disease, can be able to grade at what level we are in, and what option can we do as far as management is concerned. And checking your optic nerves doesn't mean that you should have eye pressure. It doesn't mean that you should have an eye problem. It doesn't mean that you should be having an eye problem or an defect. But you must check your optic nerve every time, because the glaucoma does not pain and it is hereditary, and you only see the signs when it is at a late stage. Sometimes some patients get the most early signs, sometimes where they get is that sometimes when they look in the light, they are able to see a rainbow around the light. That's most of the times the early sign of this type of glaucoma that we are really doing the awareness about in this period or in this whole week. So sometimes we see some of those symptoms, some of those signs, and someone says, you know what, I'm able to see a rainbow around the bulb, around the lights. But many times, many people leave it the way it is, and they keep living even when they are seeing funny things. Someone will say, I saw a curtain pass in front of my eye. I saw a rainbow. So all those things are very, very important, and they are the earliest signs of glaucoma. And that one is when you're really blessed in a different way for you to see some of those signs, so that you can wake up and come for an eye checkup. But sometimes people don't see any signs, and they just wake up. One time I saw one of my clients, a child was in primary 7 here in Uganda. It's a top level in the early education. So this child was studying very well until when he was doing the final exams. So when he was doing the final exams, he did his last paper, and when he stepped out of the examination room, he lost sight. And there were very many superstitions around the scenario. Many people thought it was witchcraft. They went to witch doctors and different doctors. But when they reached there, they didn't see any difference. They didn't improve on sight until they came to us as eye health workers on the last resort. But to check the eyes of the young star is only to find out that the